A lot of the women come here obviously just hearing the diagnosis literally sometimes hours or days ago. And you have to really hold their hand through this whole process, because not only are they emotionally dealing with the fact that they've just been diagnosed with cancer, they're dealing with the possibility that they have fertility issues potentially looming but for this intervention.
We will bring you the story of this doctor and how he is preserving the life of future generations in just a moment. But first, cancer diagnosis can be devastating, but losing the ability to have children after chemotherapy or surgery can be just as devastating. But now there is a new program for young women that offers them hope and the possibility to have children, even after cancer. This is a normal afternoon for Vianney Ferdinand and her 16-month-old son Aiden, but there have been some hard days here too.
When the doctor first told me that I had cancer, my first thought was, what about my future?
Aiden was barely a year old when his mom was diagnosed with breast cancer.
There's a lot of things that come with cancer, knowing what to do next. You know, it's just a lot. And even finding the right words to ask someone, a doctor, what to do. Ferdinand underwent a mastectomy and chemotherapy, and one side effect of her treatment was early menopause. Sometimes I get upset because, you know, I want to be living my life, you know, the way a regular 26-year-old would.
A big family was always the plan for the Ferdinands, and so she was counseled to freeze her eggs for the future. But they worried they could not afford the procedure.
I just decided to look into it, see how much it was going to be, to see if I was going to be able to afford it.
And that is when she met Dr. Tortoriello.
If you come through here as a cancer patient and we freeze for you, and we hold on to these eggs or these embryos for you, we're holding on to them for you until you decide it's time to use them, and there's no charge.
That's right. Here at the Sher Institute, there is no charge for egg retrieval, fertilization, and later implantation for cancer patients whose disease will impact their future fertility.
The major expense is that of the actual physical work. It's my work. It's the work of the embryologists. We are willing to do that, and we are very gladly willing to do that. Then it's very, very doable, and we just think it's the right thing to do.
This is a procedure that normally costs upwards of $10,000 and is rarely covered by insurance.
And a lot of women can't believe that we're willing to do it. They're looking for the string. There's no strings attached.
I've never been married. I had no children of my own. And it seemed like when I was diagnosed, all the doors have been closed for me.
37-year-old Kenia Sarita was diagnosed with uterine cancer and last May underwent a hysterectomy. She also found her way to Dr. Tortoriello and was able to have some of her eggs retrieved and frozen.
When he said, we provide the services for free, you don't have to pay anything, the medications, not lab work, anything. I was amazed. My jaw just almost dropped to the floor.
There is actually, for many women, a tremendous race against the time because their oncologists are recommending chemotherapy or surgery literally, you know, now.
She hopes to have her eggs fertilized and implanted into a surrogate at a later date, again, at no cost.
It's like that stress that I was feeling is so much, it has been made so much easier.
I think in the rush to get them cured from their cancer, most oncologists are rightfully focused on that, but maybe secondarily think about the fertility. There's no reason to not think about both.
As for Vianney, she finished her chemo in June and is currently undergoing radiation. It will be at least 3 years before she gets the go-ahead from her doctors to try and have another baby. And when she does, Dr. Tortoriello will be there, holding true to the promise he made by implanting her embryos as she gets ready for the next chapter in her life.